The next speaker is Nicolas Behrens from Germany. He's an MD, and he worked as a team member of the Interdisciplinary Pain Clinic and as a senior physician at the Clinic for Physical Medicine and Rehabilitation at the University of Munich. He researched about effects of acupuncture and chronic neck pain and dysfunction together with Dominic Irnish, our board member too, and publications in pain and BMJ. Since 1998, he owned a practice for pain therapy in Munich. He's instructor for the EGFA Medical Society since 1986 and specialized on pain therapy, locomotive system, and myofascial trigger points and cyclotonic to laser. So the topic is acupuncture plus utilizing the strong points of needling in a bio-psycho-socio-spiritual approach. Please, Professor. Thank you.
Well, thank you for your invitation. And I will talk about this at the example of chronic low back pain, which is my area of treatment. And I will talk also about the backgrounds of back pain in this case. So somehow it doesn't work. Oh, now it works. So my background, as already was mentioned, I worked for 2 years at the pain clinic, and I have additional education in manual medicine, in dry needling and trigger point therapy, also in psychotonic glass. I will talk a bit about this, and in systemic body-orientated psychotherapy and some more. My priorities are trigger point treatment, that's the hardware, the structure, and in psychotonic, which is the software, and there's a lot about the attitude of the patient toward life and relationship. And together, I call this Acupuncture Plus. And thanks to Jochen Gleditsch, he was my mentor, to Chen Gun, who taught me the dry needling, and Volkmar Glaser, who found the psychotonic, which is really somehow opening new aspects for understanding acupuncture. And thanks to my patients. The optional PDF, I will put it into the chat, so if you want to, you can load it down afterwards, because I have to rush a bit. So, now something from Plato: the greatest mistake in the treatment of diseases is that there are physicians for the body and physicians for the soul, whereas both cannot be departed from each other. That's 2,500 years ago, and we're still not much further, I'm afraid. And acupuncture, I think, can help for this. So we teach a lot about technical accesses, which needles and points to take, but as important is relationship, how to deal with the patient. I want to explain you my access by this diagram of iceberg, and the low back pain is just the surface, that what you can see. And then we have some biomechanics and trigger points that can influence each other. Trigger points can make biomechanical and even osteo changes. And of course, changes at the spine can influence trigger points. Here you know all these trigger points in the quadratus lumborum, the joke of low back pain, very important, and often overseen the iliopsoas, the hidden prankster. If it's shortened, it just makes strong lordosis of the lumbar spine with secondary problems. So what are the strong points of acupuncture in the needling and the treatment of low back pain? Sorry, I can't see a part of my presentation. It's immediate release of tightened muscles. And that's wonderful. You can immediately see the movability, the motion is better, and the pain is gone. And these muscles, they cause up to 80% of locomotive system problems. It's very, very effective to use this treatment. And we can make a structural diagnosis sometimes combined with local aesthetics. So we can say, okay, these problems, this pain comes from the muscular system or something else. And we can avoid unnecessary or even damaging operations, which are unfortunately often done, forever in Germany. So low back pain, what can we do? If it's a local problem, we do a structural diagnosis to see where to treat. Can be myofascial, can be the bone, the disc, some joints, whatever. In TCM, we talk about chi stagnation and blood stasis with special treatment ways and the B syndrome, of course. That's what you all know. And for the therapy, we use distant and local points, especially trigger points. And we've done, as already mentioned from the lady who introduced me, we did this Haku's trial. And in this, no, sorry, it's not here. In this Haku's trial, we could show with just 6 treatments that we have very good effects. Although later on, the trial came out that showed that you need at least 10 treatments. So if we were successful with just 6 treatments, I think this shows that our protocol is very effective. But this local problem can be just the top of an iceberg, and it can be their generalized malfunction. And this is often looked at, well, at the static aspect, and we talk about a descending malfunction going from the head down to the low back pain, or more often ascending malfunction. So problems with the feet or the knee and so on can have an influence on the cervical spine, or on the spine. For instance, here, knock foot like this has an influence not only on the hallux valgus, but for knee problems and so on. We do here structural allocation, and for the therapy, we treat the myofascial chains, including local trigger points, which is very effective. And now from Chinese medicine, we can take the Yang Chao Mai, which has something to do with stable stance. Here you can see it. You can activate it by sweeping along this way here, and then you circle it here, and then you go up here, and you end at the gallbladder 20. And this results in a safe and stable stand and in an overview. That's what animals do to see if everything is okay, and gives you a feeling of secureness and calmness. So, but as important or even more important than static problems are tension problems. If the tension is too high, this is the basis of chronification. And so by the trigger points, we often have a direct access to emotions and traumata stored in the muscles. Sometimes when I needle, the patients start shivering or crying, and then the emotions that are beyond the problem, they appear, and so I have an access, and this is very successful. Let's go on with the iceberg. We have a chronic overload beyond the surface with increased muscular tension and a poor posture, hyperlordosis or hanging position. And now I show you something about the relationship between outer and inner posture by the peanuts. And sorry, I can't lead it. You have to stand like this if you have a depression. The best way to stand is this. The worst thing you can do is straighten up and hold your head high, because then you'll start to feel better. If you're going to get any joy out of being depressed, you've got to stand like this. I think it's really marvelous to show the correlation. The inner attitude, most people with low back pain, is endure. Under conditions, they just feel critical. So external somatic and internal psychic, we have a withdraw, a back out. That's the disease. And here you can see from psychotonic, if the Tai Yang is contracted, you have a feeling of helpless, of panic. You won't see it like this, but you see parts of it, the neck here and the back and so on. Beyond this is fear, and fear makes constriction, and fear just makes everything cold. And this is, you can say, why the iceberg has developed, because fear turns us to ice blocks. 12 million Germans suffer from anxiety disorder, including phobia, in need of treatment at least once in their lives. That's really a lot. What are the psychological causes, correlations to low back pain? You can see it here. Depression is well known, fear as well, and trauma, having been traumatized. And I add something more. It's a relationship and attachment disorder. You can talk about systemic entanglement. And I quote the Lord's Prayer, forgive us our trespasses. In the original, you can understand it's written, solve the entanglements that bind us back to the past. And the past, that's where fear is coming from. Now let's go to the meridian system. You can say the posture axis, urinary bladder, small intestine, or Taiyang axis. And when we here at the psychotonic, if it's released, the muscular along this, then it's a territorial behavior. I take my room and I'm able to defend it. So talk about the potential here, and it's stability and safety. That's what you need for a good low back. And we talk about core stability, the pelvic abdominal ball. This, if it's filled, you can do this by deep breathing, then the chi hai, the Renmai 6, is really stable. I've done judo former times, and you have a good hara and you're good in fighting. And you have a good background space. That is helpful. And now to the background space, I shift. Yeah, we talked about the Yang Chao Mai already. I shift now to the Zhang, the functional circuit, we say it in Germany, the kidney. And we all know the kidney there, the yuan qi, the ancestral energy, is said to be stored. The kidney deficiency at the root of many diseases and problems. Fear with somatic stress reaction often is activated by trauma in early childhood, by severe relationship disorders inside of family systems, and this disturbs basal bond trust and behavior. This blocks us, makes us physical, especially muscular and emotional, narrow. It doesn't flow, and development and vitality are disturbed. There's an unstable, unsafe, worthless feeling and life. We just have patterns of survival and not of vitality. It's compensated by overactivity, including fear-driven thinking, escape to the inside, burnout, no interest, or even physical dissociation. Thomas Henner is speaking about sensomotoric amnesia, and you can often find this in patients with chronic pain. For efficient therapy, we need more than acupuncture or Chinese pharmacotherapy. It's not enough. We need a good relation to the ancestors. They are worshipped in Asia. And systemic family constellations are very helpful for this. You can influence the view of your family systems, and that's good. It's all about backing and support. And chronic pain patients are fear patients. Well, now for the solution, we have the Shao Yin axis, kidney, heart. And there we know Shen is stored. And this can melt the iceberg. And it's forgiving others and yourself. It's looking for solutions and for delight. So we can also have strong points. It's the psychosomatic understanding through acupuncture of the organs as systems of body-based emotions. The kidney for fear, frozen constriction, withdrawal, and so on. the meridians as basic patterns of behavior, as I showed you before, and extraordinary vessels as stages of human development. I would like to show you, but therefore we would need a workshop. And so we have a somatic, psychic access to the roots coming from the body to the whole patient. And we can get to the roots of physical, emotional, social, and spiritual problems. This enables more than usual prevention and treatment. We can use symptoms as a key to a deeper understanding and healing of ourselves. And I heard this, symptoms are love letters from our body. So, what can we add to complete this? Systemic therapy, as I've said before, trauma therapy. And in Germany, Jürgen Schotthoff developed a special form of trauma acupuncture, or you can use somatic experiencing or something else. But it is important. And spirituality, I think it's our biggest resource and so seldom used, because many people have fear of religions and so on. And the question is, which is helpful? And I citate the Dalai Lama, who said, the heart of all religions is one. And we can use our own experience from our own development and our heart-opening attitude. That is so important. And I've cited from Rumi, beyond judging, there's a place where we can meet from heart to heart. And then let the patients find their own way, give them trust to themselves. Well, what's the reality in Western world? In the US, 50,000 tons of paracetamol is consumed every year, the equivalent of 300 pills per person. That's the opioid and operation crisis. Much too many operations as well. And it's caused by a one-sided view of pain as enemy and the influence of the pharmaceutical industry. This turns humans into machine-like survivors. So, what can we do against fear? Don't run away, but turn around. We need warmth, human warmth. Body awareness, embodiment, that's a strong point of acupuncture when we put the needles. And for me, an explanation that so different ways of acupuncture are helpful. It's just getting back to be aware of your body. And then qi flows, Tao Qi. The contact and touch is so important. If you go to the feet, it's helpful just to activate kidney yin, or the four gates are very helpful. And this helps to be present in the body. And our body is our basic reality. We are real beings and not digitals, as some people think to be. And give a stable stance, a back hold. And this is territory feeling. And this can be activated by Tai Yang and Yang Chao Mai. The ability to set flexible boundaries with a contact to the surrounding. This means to be present in one's space. That's the Yin Chao Mai, activated by kidney 6. Learning to open up, develop trust. That's the kidney heart, the Shao Yin axis. And have stable relationships. And we learn to say yes to ourselves and to others. That's the Chong and Dai Mai, by the way. And we know who and what we are, what is our core or source, that's spirituality, and then be aware of our divine nature. The Ren and Du Mai, as far as I know, are also named as the royal channels. And I come to the end with Benjamin Crew. He was a neurosurgeon and co-founder of the International Association for the Study of Pain, one of the pioneers in the world of pain. And when all were searching how to interrupt pain, perfusion and so on, he said the answer to pain is love. And I understand love here as conditionless acceptance of all that is. And this loses muscular and emotional resistance and tension.